Hello everyone, my name is Padmashri Sunkar, BSc 6th semester, paper Chemistry 2. Topic is synthesis and therapeutic uses of analgesic and antitherapeutic paracetamol, analgin, ibuprofen and dichlorofen sodium. F is a local anesthesia, no vaccine. First one, objective type questions. Which of the following is primarily an anti-therapeutic and analgesic but not an anti-inflammatory? The answer is paracetamol. Which is the primary mechanism of actions of ibuprofen? The answer is non-selective COX inhibition. Third one is the analgin is also known by which chemical name? The answer is metamizole. What is common side effect of dichlorofen sodium? The effectance is gastrointestinal irritation. This is the answer B. Fifth one, which of the following these drugs is not recommended for children under 12 years due to the risk of rare syndrome? Answer is aspirin. Sixth one, Novoxin is commonly used in which type of medical procedure? The answer is a dental procedure. This is used in dental hospitals. Which is the main actions of local anesthesias like Novoxin? Answer is B, blockage of sodium channels. Eighth one, which is the local anesthetic is also known as Novavaxin. Which of the following is not common uses of local anesthesia? This is the ninth question. Answer is treating the infections. Next, 10th one. Which of the following is the local anesthesia has a longer duration of actions than no vaccine? Example is Bupi vaccination. Then one more questions. First one, what is the primary therapeutic uses of paracetamol? The answer is to relieve the pain and reduce the fever. The second one is which enzymes is inhibited by ibuprofen to exert its effect? Cyclooxygenase. This is the answer. Third one, what is the another name of analgin? Answer is metamizole. Next, fourth one, name the common side effect associated with dichlorofen sodium. Answer is gastrointestinal irritation. Fifth one, what is the major risk associated the uses of aspirin in children? Reye syndrome. This is the answer. Sixth one, what is the primary action of Novoxin as a local anesthetic? Example is the blocks the sodium channels to prevent nerve impulse transmissions. Seventh one, for what type of procedure is the Novoxin most commonly used? Answer is dental procedures. Eighth one, which chemical structures does Novoxin belongs to? The answer is amino esters. Is the chemical structure does Novoxin belongs? Ninth one, what is genetic name for Novoxin? Is Provaxin. 10th one, which local anesthesia is known for having longer duration than Novoxin? Answer is Bupivax. Then 2 marks questions. Describes the general synthesis pathway for paracetamol. Answer is paracetamol is synthesized by the nitric of phenol to produce the p-nitrophenol, following by reducing to p-aminophenol, which is then acetyled using acetic anhydride. Then question 2, what are the therapeutic advantages of ibuprofen over aspirin? Answer is ibuprofen is generally associated with a lower risk of gastrointestinal side effects composed to aspirin compared to aspirin, and it's effective to reducing the inflammation, pain, and fever. Third one, explain why dichlorobenzodiazepine is often preferred for inflammatory conditions. Dichlorobenzodiazepine is a protect non-steroidal and anti-inflammatory drugs NSAID with a strong anti-inflammatory and an analgesic and anti-therapeutic properties make it effective for conditions like arthritis. Question number 4, what is mechanism of action of analgin and why it is used restricted in some countries? Analgin works by inhibiting prostaglandin synthesis, reducing the pain and fever. It's used to restrict in some countries due to the risk of organoglitosis is the potentially life therapeutic conditions. Question number 5. Discuss the dual action of ibuprofen as both an analgesic and an anti-inflammatory drug. Ibuprofen answer is ibuprofen inhibits COX enzymes, reducing its inflammatory of prostaglandins involved in a pain and inflammation, thus providing refers from its both symptoms. Question number 6. Outline the synthesis of vaccines from benzoyl chloride. Nova vaccine is synthesized by reacting benzoyl chloride with the diethylamine and through an extraction esterification reaction. This is in the presence of sodium to form the pro-vaccine through an esterification reaction. Question number 7. How does the structure of no vaccine influence its pharmacological action? Novocation esters linkage is a rapidly hydrolysis in the body, leading to a short duration of action. Its structures allows it to effectively block sodium channels, preventing nerve impulse transmission. Compare the uses of no vaccines and idle vaccine in medical practice. No action is used to mainly in the dental procedure due to its shorter duration, while idle vaccine, which is with its shorter dangerous action, longer action, and more versatile profile, is used to variety of medical and surgical process. And question number 9. What are the potential side effects of using no vaccines? Potential side effects include allergic reaction, cardiovascular effects like hypertension, and central nervous system effects such as dizziness or therms. The next 10th question describes how the pH of tissues can affect the efficiency of no vaccines in acidic environments. This is the answer. In acidic environments such as infected tissues, no vaccines is the less effective as more of the drugs is ionized, reducing the ability of prevented the nerve membranes and block sodium channels. And 5 marks questions. The first one is discuss the detailed synthesis and action mechanism of paracetamol, including its therapeutic applications and potential side effects. Paracetamol is the answer. Paracetamol is synthesized from phenol through the nitration to form p-nitrophenol, which is then reduced to p-aminophenol. Acetylation of p-aminophenol with acetic anhydride yields paracetamols. It acts centrally by inhibiting the COX enzyme, reducing the synthesis of postal stage glands involved in the pain and fever. Therapeutically, it's used for mild to moderate pain and fever. Overdose can cause hypertoxicity due to the formation of toxic metabolic NAPQL. Question number 2. Explain the synthesis of dichlorophene sodium. It's a paramesyl kinetic properties and its rules in the managing inflammatory conditions. Dichlorophene sodium is synthesized by chlorination 2,6 dichlorination and reaction it with sodium hydrides to form the sodium salt. Dichlorescence has a high overall bioavailability, is extensive, metabolized in the silver and it's excreted via urine. It exhibits COX2 reducing prostaglandins synthesized. This is the elevation in inflammation and pain. It's widely used to arthritis and the other inflammatory disorders due to its protect the anti-inflammatory effects. Question number 3. Outline the synthesis of Novaxin and discuss how its chemical structure affects its pharmacodynamics and clinical uses. Novaxins or provaxins is synthesized by reacting benzyl chloride with the diethylamine acetol, forming an ether linkage. The ester bond is ready to hydrolyzed, results in a short duration of action. The structures allow it to block sodium channels on nerves membranes, preventing impulse transmission, making it useful to dental process for quick and short-term anesthesia. Its rapid metabolism limits systemic toxicity through allergic reactions can occur due to proaminobenzoic acid PABA formation. Question number 4. Compares and construct the mechanism of action, therapeutic uses and side effects of ibuprofen and anaglin. Both ibuprofen and anaglin inhibits progastrodin synthesis, but ibuprofen is a non-selective inhibits COX1 and COX2, which analysis adds more as prodrugs with its activity metabolic directly affecting pain pathway. Ibuprofen is used for mild to moderate pain, inflammation and fevers. Its side effects including gastrointestinal irritation, renal effect. Analgin, while is also used for pain and fever, has a risk of organolysis, leading to its restricted use in some regions. Question number 5. Discuss the impact of pH on the efficiency of local anesthesias like Novaxins and how this influence their use in infected tissues. Local anesthesias like Novaxins or weak base is the answer and exist in equilibrium between the ionized and non-ionized forms. In an acidic environment, the ionization form the predominated, which is less able to prevent the nerve membranes, reducing the efficiency. This can result in reduced the anesthetic effect in infected areas. Adjusting pH by buffering or using anesthesia which is different ionized properties can improve the efficiency in such conditions. Thank you.